All right, stream has just started. So hi everybody, thank you so much for joining us for our fourth virtual shadowing session with Dr. Davila. Dr. Davila is a prosthodontist and we're really excited to have him here. So thank you so much, Dr. Davila, for joining us today.
Thank you.
Well, good evening, everyone. Thank you very much for the kind invitation. Very happy to share with you some ideas in how to becoming a great dentist so that you can serve your communities and people that actually have dental problems. I want to talk about what I do every day and how actually I got into becoming a prosthodontist. Let's go ahead and, let's go ahead and do this here. There. First of all, they asked me to talk about my biography. I was born in Lima, Peru, and I grew up pretty much in a dental office. My father was a retired general dentist, and then after school, I used to spend a lot of time in his office because my mother also used to work. And I used to have some of my homework after school in my dad's office. And as long as the years passed, then I started working and seeing the type of work that he was doing and how he was helping people that came with dental pain or dental problems. And then I decided to learn, and he started teaching me how to repair dentures, how to make dental models. And I started enjoying what he was showing me. Okay, so then I decided to become a dentist, and I did my dental school back in Lima, Peru. And over there, it's difficult to get into a dental school, but you can go straight from high school. It's usually a 6-year dental program. The school that I went, it was a small program, private university with we were 35 students in my class. So, and I had a very good education. We had a lot of professors that were trained in the US. And then I finished my dental career very young. I was 22. I was actually even 21, I was already a dentist. Okay. Wow. But it was difficult because I still, when I was 15 years old, I spent a summer in high school in Philadelphia when I was in high school, and I also put my mind that I wanted to further my education in the US. So I moved to the US and decided to continue my education. So I went, and the first thing I started working on was doing an advanced general dentistry program. And it's basically a general dentistry program that you have exposure to all kinds of procedures in general dentistry. Is a lot of dental students, probably about even 30 to 40% of dental graduates go into advanced general dentistry programs to further and improve their skills, fine-tune their skills. And then, of course, there are prosthodontic programs, okay, and that's what I went through. It's a 3-year program in which you see patients with complex needs, and also dental technology program in which you learn how to do procedures like in the dental lab, and how to manufacture, how to create the final prosthetics. And a maxillofacial prosthetic program is a super specialized program, and it's a super specialty of prosthodontics in which you learn how to treat patients with complex needs regarding surgeries because of cancer or congenital defects or trauma. So basically, I have gone through all of this, and I'll explain to you how was my journey into what I'm doing now. This is our office. We built an office. I've been practicing 27 years in Tampa since 1993, and we have a full office where we have 2 doctors all the time, and hygienists, dental technicians, and a full service lab. What is a prosthodontist? A prosthodontist is a specialist in the restoration and replacement of teeth. So that means he's a highly trained in cosmetics, dental implants, crowns, bridges, dentures, temporal joint disorders, like we call it TMJ or TMD, and more. Regularly, and most of the time, we lead teams of general dentists, specialists, and other health professionals to develop solutions for complex dental needs. So that means we meet with a lot of dental specialists because we see a lot of patients with complex treatments. What is a maxillofacial prosthodontist? So maxillofacial prosthodontist is a subspecialty of prosthodontics that involves the rehabilitation of patients with defects and disabilities that were present when born or developed due to disease or trauma. When I mention disease, most of the time it's oral cancer. Prostheses are often needed to replace these missing areas of the bone or tissue and to restore oral functions such as swallowing, speech, and chewing. You could see chewing is the last thing that we actually emphasize, because most of these patients, the first immediate need is to be able to swallow and to talk. And then later we'll help them with chewing, because those are the main initial needs they have. So my journey to becoming a prosthodontist, as I said, we mentioned before, I went to school at Cayetano Heredia Peruvian University. At 21, I was a dentist. I worked for a year working with my dad in Lima, Peru. Also, I worked for one of the very few US trained prosthodontists in Lima, Peru. And that pretty much opened my eyes to this field. So he was one of my mentors. Even though my dad used to do also some prosthodontic work, it was different in the office of this other prosthodontist. His name was Mariano Flores, one of the best dentists in Lima, Peru. So I just offered my services for no pay. Just I wanted to work with him and observe what he was doing and help him in anything he needed to have. And I was able to see the difference as far as the complexity of the care and the complexity of the things that he was doing and he was providing for his patients. So that was pretty much my first goal. I decided that, well, I want to be like my dad and I want to be like this prosthodontist. That's my first goal. So you have to actually set up a goal in your life and then be persistent to obtain it. Of course, after that, I was one of my mentors from the Peruvian University. He was trained at the University of Rochester in Eastman Dental Center in Rochester, New York. And I had the opportunity to visit and work hard. And I was accepted to become a resident as a general in the Advanced General Dentistry program. I enjoyed this full year of general dentistry at Eastman Dental Center. It's a great center. Probably is the largest in the world. They have 50 residents in general dentistry from all over the US and also from all over the world too. They have people from out of the country. After that, it was the same thing. I mean, I worked hard, and then one of my mentors went to University of Louisville. I wanted to become a prosthodontist. So I applied to multiple prosthodontic programs, and I was accepted at the University of Louisville School of Dentistry, where I did most of my schooling. So what I did in Louisville was my prosthodontic training. I did a master's in oral biology, and I did my advanced standing to be able to practice in the United States. So pretty much like going back to school for last 2 years of dental school. And working in Louisville, Kentucky, I actually got in contact and be able to work with the only maxillofacial prosthodontist in the region of Kentucky. So that means that he was treating on a daily basis patients that had oral cancer defects or having gone through oral cancer surgery. And then I offered myself to work with him during my prosthodontic training. In my second year, I used to work 1 day a week at the James Brown Cancer Center in Louisville, Kentucky, treating cancer patients with this doctor, Dr. Jafuria Khan, who is a maxillofacial prosthodontist. He was trained at the University of Texas, and after working with him, this was like a new area for me, and I decided that I wanted to help patients with these kind of problems and wanted to look for further education. So I was accepted to be a fellow now at the University of Texas MD Anderson Cancer Center, which is very similar to what we have in Tampa, like the Moffitt Cancer Center. It's a third class, or it's a first class hospital, world renowned. We have in the University of Texas in Houston, they have a lot of patients from all over the world that come for their cancer treatment. So basically, that's after finishing my training. After many years of training, then in '93, I moved to Tampa, and I was hired as a full-time prosthodontist, maxillofacial prosthodontist at the Moffitt Cancer Center. So I work with head and neck surgeons, other oncologists, many different disciplines, speech pathologists, in helping patients with complex needs. With the head and neck surgeons, pretty much we were very busy for about 3 or 4 years, and things changed between the head and neck surgeons, and some of them decided to leave the hospital, and there was some changes in the head and neck program. So because of those changes, I just decided, or I was kind of forced to go into private practice. So I went into private practice, and I've been in private practice since '96. But I still continue seeing patients that have gone through cancer therapy. What is my advice? They asked me what advice for college. Well, first advice for college is enjoy your college life on weekends. So that means you have this experience, okay? It means I don't want you to study every minute of your life. You have to enjoy your life. It means college life is wonderful, okay? But you also, I recommend that you study hard from Mondays through Thursdays. Okay, maybe just get a routine, get something that you can actually, because once you have a goal, in order to achieve it, nothing comes with little effort. Everything will come to be, and you'll be rewarded with all your goals. So but you need to put a lot of effort and hard work to obtain it. Other advice for you, this group, will be volunteer to dental offices. I know that we put an ad for to have some interns. I'm sorry to some of them, we did partial responses, but right now we have 4 dental interns in our office, and they are working great. Every intern that we have in our office at different days, it means they have their goals set up to become a dentist, and they're great. It means I think all of you, when you have that focus in your mind, then you're great. So they're experiencing, maybe in the future, if we have any more openings or a capacity, will actually keep their names for having an opportunity to be an intern in our office. But seek for other dental offices also to be a volunteer, so you got experience. And you got, because that's something that they ask you when you have an interview at the dental school. Have you been shadowing? Have you been helping? Sometimes dental terms, what is definitely an restoration, what is resin. So there are instruments. So all of that, you may gain only that experience when you are in a dental office. Another advice will be volunteer at dental medical missions. You know, a lot of dental school, a lot of dental school applicants, they have to actually, they ask you if you have been participating, donating your time, and offering yourself to help in dental medical missions. One of the ones that I've been going in the past year is being the Florida Mom. It's called the Mission of Mercy. It is sponsored by the Florida Dental Association, and they offer free dental care for 2 days, once a year, in different parts of the country. This year, it was going to be, I think, in South Florida, Last year was in Orlando. The year before was in the Panhandle and in Jacksonville. So that means they always are open to have volunteers to help as an assistant, okay, or to help in any kind of work, because they always, everything is offering free dental service. And it was incredible how we're helping all patients that have dental issues. The other advice will be the remote area medical, that's called RAM. It means one of our interns that is coming to our office, that's how I met him. He was assisting dental students at a RAM activity in Bradenton. They offer once or twice a year in Florida, but activities are all over. I've been going to Knoxville, Tennessee, in last year, and even it's great. It's a great experience to be able to help other people and also be able to participate of that. Yeah, and that counts when you are actually going and doing your dental, you interview for to become a dentist and a dental school. Another one is Mission Smiles Mobile Dental Clinic. That also is a mobile dental clinic that has 2 chairs, and you can do everything from dental fillings, extractions, and they have every equipment that a regular dental office has, and is basically in a modified a large truck. And the person who did it did an outstanding job. In general, say, "Oh, how am I going to be able to do dentistry in a truck?" But it's incredible. You have everything that I had in my office there. So this is the mobile dental clinic. Okay, with the group that we were 3 dentists during this weekend. We worked for 2 days. I had one of my assistants and one of my hygienists working because they also do dental hygiene. Some of these are pre-dental students offering their services as a dental assistant, helping the doctors that are volunteer to offer this free dental care. This photo is from the RAM activity in Bradenton last year. They have dental students from University of Florida, and they have dental students from Lincoln also that were offering dental services under supervision by professors. I was one of them supervising the students at the dental school from the University of Florida, but there were a lot of dental assistant volunteers. And I said, here's what I met one of the interns that is going to our office now. And he actually asked me to come, and he's been coming for already a year. This is the RAM in Knoxville. Okay. Also, it was more incredible here because they have about 120 dental chairs providing dentistry. It was a big project, larger than Bradenton. And they have like 20 students from the University of Florida. They have another 20 students from the University of New York at Sunny at Buffalo. Of course, they have people from Harry, Tennessee, and they have, I think, another one from Chicago or Indiana. So they have, and also dental hygiene schools. So they have a lot of schools, and they have interaction. And also, we have some pre-dental students that help assisting some of these dental students to provide dentistry. Important terms is prosthodontics. Okay, prosto means replacement, and dontist means dealing with teeth, who are replacing teeth. Another term, we will say, okay, today I had an iOS impression. So that means dentistry is changing with technology, and technology is going very strong in dentistry. We haven't taken any dental regular impressions for crowns, and now for implants. For crowns, probably for 10 years, okay, or more. For implants, probably in the past 4 years, unless it's a large implant case. So it's iOS means intraoral scanners. Another term that is commonly used is CBCT. So that means cone beam computerized tomography. So in the past, probably 10 years, because I had one of the first machines in 2006. So it's about 13, 14 years now. And now it's more commonly used in dentistry. In that time, we only had maybe 1, 2, 3 machines in Tampa. But now we're able to see in 3 dimensions and be able to make a diagnosis, a better diagnosis, to create better treatment plans and even provide better treatment for patients, because now we're able to have visualize in 3 dimensions the actual patient, because we can see that, and in combination with intraoral scanning imaging, we can combine these two technologies and then be able to see the soft tissue and the teeth together in just one software. Dental implants are to replace missing teeth, and that's pretty much what we do every day. Crowns to restore fractured, worn, or decayed teeth, and that we also do every day in our office. Bridges is another solution to replace missing teeth. Even though during my training, bridges or bridge work, crown bridge work, was one of the main things in our specialty of prosthodontics, every year I'm doing less and less and less bridges. And most of the dentists are doing the same, because we're actually, before we have a single tooth that is missing, the best solution is to have a dental implant, because long term that will actually be the best solution for the patient. Veneers, they provide cosmetic improvement in shape and color of teeth. Dentures, removable replacement of teeth. So those are the most important terms, or some of the important terms in my field of prosthodontics. They also ask me, what is a typical day in prosthodontics? So I have two different kind of days. One is my clinical work at the office, in which we do a morning huddle, and we do clinical prosthodontic work using intraoral scanners, IOS, and CBCT, so being computerized tomography. These two technologies, we use that on a daily basis to help our patients with complex needs. The other thing we do, we collaborate with two dental laboratory technicians working at our full service in-house dental lab. So there is a full service digital lab to use a lot of dental technology to create the dental prosthetics that I need to help my patients. Also, being myself a certified dental technician, we work with them and we solve problems. And also, a part of my work, it means once a week, I go to the Moffitt Cancer Center to participate in the head and neck cancer boards, to use support the work of the head and neck surgeons at the head and neck program at the Moffitt Cancer Center. And also 2 days a month, I'm faculty at the University of Florida College of Dentistry, and teach and perform clinical work with graduate residents in prosthodontics. So I have very little contact with the dental students. I have more contact with the residents. So they're already dentists doing their specialty in prosthodontics. We do dental implant surgery. Most of the time I go or work on complex patients with complex needs. To the dental students, I only give them 1 or 2 lectures a year, and we call it the advanced lectures on digital dentistry. This is the University of Florida. This is the big campus with the Shands Hospital and the Cancer Center also in Gainesville, Florida. The dental school is this one. It's about I think it's 12 or 13 floors. And the whole building is the dental school. The dental clinics are usually in the 3rd and 2nd floor. Or most of the faculty are on the administrations are at the top floors. The resident programs or the graduate programs are on faculty practice are on the 1st floor. And everything is connected to the library, the health science library. And all of this is just the Shands Hospital, that is one of the main referral hospitals in the north part of Florida. We have a lot of interaction. All of these that are dressed in blue scrubs are prosthodontic residents. Dr. O'Neill, he's the director, has been the director for 15 years. I've been doing this for 15 years with them. And of course, we always have fun also with full-time faculty. Dr. O'Neill, Dr. Wong, they are full-time faculty. Last year, with your specialty, especially you have to take the what we call the boards. So you challenge yourself between your peers and take a very rigorous examination to become a diplomate or a board certified prosthodontist. And every specialty has it. So Dr. Juan here in the middle was taking the boards, and we were the mock examiners. So that means we examined her because the following week she was going to take the boards, and she did okay, even though her face doesn't look like that. But we had fun with her. We drilled her with a lot of questions, and she did well. She passed her boards. Well, now I'm going to talk about the use of advanced dental digital technologies to achieve efficient and predictable results in our daily restorative procedures. So this is exciting, and especially when I have my children, they go, and you'll be able to see. Okay, well, this was the introduction of one of the latest intraoral scanners last year. This young gentleman was one of the developers from a company called Dentsply Sirona. He was able to scan his whole mouth, upper and lower arches, and the bite in 45 seconds. So that was pretty much a record as far as the timing. It's one of the fastest and most intelligent softwares available now, and produce pretty much a very clear picture and a very detailed and accurate impression. From here, we can develop, of course, we can do every dental prosthetics possible. And also we can print using 3D printers instead of using stone models. So there are a lot of multiple scanners for iOS that are being used over time. Some are better than others, some work better than others. Okay, some you can design and mill crowns within 10 minutes. Okay, and some you actually have to work with labs, take the impression and send that to a lab like this group at B and C. But technology is growing very fast in dentistry, and it's exciting every time. For example, here we have machines that can, before some of these machines were able to scan only a couple of teeth, 2 or 3 teeth, but we consistently can scan the whole mouth. This is part of my team. Okay, all of them have very high skill scanning intraorally in the mouth. So that means this is implants, dental implants. What we do, these little are called scan bodies or a crown. But what they enjoy actually, once I prepare a tooth or to a patient, they'll take care of the rest using these scanners. Here is going to show you this video, how they are doing and how I'm taking the role of mainly supervising, because after I do what I need to do, preparing teeth or even placing the implants, they'll do the rest. They'll scan, and it's like they have fun. Of course, that was prior COVID. Now we have a different kind of PPE protocol with more shields and more gowns. But this is prior to COVID, so we always use gowns, even prior to COVID. Of course, right now we use a N95 mask. I will have a second mask, and on top we have a head protector and a shield. But I mean, we're taking the role of supervising our staff. Intraoral scanners are incredible because right now, when doctors get into this technology, initially they're scared because of the investment. But if they use it to the max, you have a good return of the investment very quickly, because there is nothing restoratively or prosthodontic that cannot be done with crown bridges. And as you can see, some of these images were the first initial things that were actually done. And then over time, I've been adding my own pictures of partial frameworks, full arch reconstructions, dentures, and maxillofacial prosthetics, because these last two pictures were not part of the initial range of indications for intraoral scanners, and now they are part of it. So that means a patient comes with a broken tooth with something we call the margin. We prepare a tooth for a crown, and then once we do that, we show to the patient how the tooth was broken, fractured, and now we actually did preparation. The software itself even marks where the crown is to be finished, and then everything is created. Like a patient comes like this with broken tooth, and they can go home the same day with a permanent crown. So that means he has a broken tooth and coming the same day like this. Comes with a broken tooth, the tooth is prepared, and the same day the patient can go home with a new tooth. This is pretty much how the machines work in the office. So we design on this machine, we have a three-dimensional restoration. We have different blocks. This is my daughter also, who is a dentist and doing prosthodontic training, helping in the lab. And one of our interns are doing that. We're teaching them how to finish some crowns. These are machines making crowns or fabricating restorations. And we can do about 20-25 restorations from one of these places. And these are milling machines that with a 3-axis burr and a block of porcelain, they are carving and fabricating crowns. Over here, we're fabricating 2 crowns at the same time. And these machines can make a crown in 10 minutes. These are lab scanners that we digitize impressions. And this is pretty much software that is creating restoration.
On purpose.
But actually, they're having fun in the lab. This is our dental lab. Today we did some crowns, aluminium crowns. These are porcelain ovens when we use ceramics. And on this other corner, we have 2 3D printers. But this is what we're doing. It means patients that have missing teeth are unable to eat because they have no molars. Then we can place in dental implants, let it heal for 3 months, and then we fabricate crowns. Some of these crowns right now, the best way of doing it is doing something called a screw retain. So we make a little channel, the crown is attached, we remove this cover, and the connection goes into the implant and is retained by a screw. And this little hole is sealed with a small filling. So in case for X reason we have to remove it, we just remove the filling and put have the crown. We have another patient that came with a broken tooth like that. We decided to remove the tooth after proper planning with a CBCT and an intraoral scanner. So even the same day, we could be able to remove the tooth and place an implant. And the same day, after grafting that area, we're able to provide her with with a temporary dental implant tooth. And that was created by the machines that I just showed you. So that means she came like this with a broken tooth inside. Of course, this was probably about 3 or 4 weeks after healing, but this is still a temporary crown that we did the same day that we removed the tooth and placed the implants. So after proper healing, we actually see the implant already completely healed. We use something called scan bodies. So that means instead of regular impression, this scan body gives us the information that we need to fabricate the final tooth. And then we have an abutment, a model, and then we fabricate the tooth. She had definitely tetracycline stain. She refused to have any kind of veneer work, but we just wanted to reproduce what she had. And she was happy to what she had. And because of even challenging colors of her teeth, we're able to provide her a good results, coming from here, having a broken tooth and having a permanent tooth for years. Other patient with complex needs is a patient, there is a congenital problem called a melogenesis imperfecta. So there are patients that come and they had congenitally, they have problems in which the enamel was not developed properly. They may have good roots, they may have good denting, that is part of the tooth, but enamel is bad, poor, or is gone. And there are different degrees from mild, moderate, or advanced. For example, her natural teeth, on all her teeth, her natural teeth were discolored. So that means there was no enamel on all of them. And all of these were temporary resins or temporary resin crowns when she came to our office. She was already 16, getting ready to go to college. So we had to do something because she wanted to move to a different state and start a new college life because she was not happy. Definitely, she didn't feel comfortable with existing dental condition. So we did orthodontic treatment for a few months to intrude or to move these teeth up to get a better result. And here's a sequence. So it's a complex treatment. I don't want you to learn, but there is a lot of complex treatment working with a periodontist or doing ourselves as far as doing surgery to make the teeth longer and then preparing the teeth and making printed models and crowns made by this machine and then fabricating the final crowns. So basically going from here to here is a complex treatment because we're changing the bite, we're improving the shape of the teeth, and we are putting individual crowns on every tooth that is present in her mouth. And she was at age of 17. She already had 28 crowns that she will need to take care of them. Her hygiene was good. It was just she didn't have she didn't have the enamel that everybody or the majority of patients have. So that means we use technology. We use those scanners to create these models and also create temporaries. And we're able to change her life like that. And that's what is mainly one of the reasons you are into the medical field and in dental. I mean, some people say, okay, you're going to remove teeth and do fillings. And that's not it. You're actually also helping patients to get a better quality of life, improve their self-confidence, and be able to be in their communities and actually do a good member of our community. So this was the best smile she had when she came, and now I don't need to ask her to smile. She just say, "Give me have a picture," and then she smiles big like that. You see, some of these are major changes that we actually do in our office. These are, I'm just going to show you how we do this, and this is a recent, that's another patient, very similar. Okay. Because of very severe form of condition. So they had these. It's like playing with your iPhone right now. And when we show this to the patient, I mean, they get very impressed. So this is what we created. These were prepared for crowns or caps or veneers. And then after that, then the software will create all the crowns that the patient will require to have. So, and with this technology, we make changes like this. Patients that have with a very severe worn dentition, a collapsed bite, years of grinding and clenching, and probably even acid reflex problems, but we're able to provide them with basically with new teeth coming from, and also with the new smile. So the first thing is we'll have to restore proper function, but we also want to create a good smile. It's not just I want to get a good smile. A good smile could be done removing all her teeth and make dentures, but we want to create the best function for the patient. You see, so he still had good teeth. He just needed to have some work. We did the same thing as in the previous patient. We first worked on his gums, make the teeth longer, and after the teeth were longer, we had enough tooth to hold caps or crowns that can last for many years as long as he has a good dental care. That's another patient in which we applied now dental technology to do a full arch reconstruction with implants. So what does it mean? Even though some of these were teeth on a partial denture, that means that the patient takes the denture in and out. He only had like 5 remaining teeth with severe gum problems. So his condition required the extraction of all his upper teeth because it was already in not adequate condition, were not healthy teeth. So after the teeth were removed, we placed 5 dental implants. You can see 1, 2, 3, and 4, 5 dental implants. And then we did what we call a full screw retain prosthesis. When you see in advertisement as teeth saving a day, so that means that we're actually doing the same thing. So we're removing the teeth, placing implants, and the patient can go home with temporary teeth the same day that the teeth were removed. The teeth were removed. And we can also provide a great result on this patient, changing their lives. These are surgical guides that we create in our office using 3D printers. Pretty much this will provide me sleeves that will tell me the angulation, the depth, and the position of the dental implants within the bone. And now talking about other patients, these are patients that have gone through cancer treatment. So I will explain to you, and this video will show, we call this a special prosthesis. Portion of the mandible was resected because of cancer. After the cancer was removed, this is a defect. So not only the teeth were missing, portion of the jaw is missing, and the tissues are different. They're very flat. They don't have any good shape to retain, and he's only able to eat anything. So we created and designed with what you call a swing lock mandibular prosthesis. So it pretty much is a locky prosthesis with a very large framework, okay, that we split all the remaining teeth, and on this area we replace all these teeth together, so the patient now is able to bite down and chew on the resected side where the tumor was removed. Of course, people will say, why not placing implants on this patient? And definitely that could be a good, also another alternative. Some of these patients will have gone through radiation treatment. And when a patient goes through radiation treatment, they lose the blood supply of the bone, of the tissues that have been radiated. And doing any kind of dental surgery, like a tooth removal or dental implant, can create a complication called osteoradionecrosis, in which we have some bone that will never heal and can be very complicated, that can actually lead to even more resection of the mandible. So that's why dental implants, in the majority of the time, are not indicated, or they are not recommended when the patient has gone through radiation treatment due to cancer therapy. And these are all kinds of prostheses that we also see almost every day in our office. Patients that had cancer and portion of the maxilla was removed. So because of the cancer, so that's the surgery saved their lives, but their remaining defects that here communicating with the sinus cavity or the floor of the nose. So we fabricate this type of prosthesis that go and obturate. We call this an obturator prosthesis. And this is another one in which this patient has sometimes limited opening and has a large opening behind her anterior maxillary teeth. We create this prosthesis to obturate. What happens is that without this prosthesis in this patient, food will go through the nasal cavity and go through the nose. So that means every time they will drink water, a glass of water, the water will come through the nose, and that pretty much, and also they are not able to talk. The sound, the N sound, the S sound will not be very legible, so will not be able to talk adequately, hard to understand when they are actually talking because of the large opening in the maxilla or in the palate. That's another patient that we did very similar. It's a different, another swing lock. So that means all of these the mandible was resected, and we did this kind of prosthesis all the time. Also had radiation treatment, and we created all these prostheses for them. This is a great prosthesis because all these teeth are connected. This is a this is an attachment here that locks in position and makes a rigid fixation. We convert sometimes, for example, this patient here was referred from the Moffitt Cancer Center because had cancer or tumor of the palate. But after the tumor was resected, we provide a prosthesis that is fixated at the time of the operation. So the patient wakes up with a prosthesis that is closing that opening that was created because of the tumor resection. And then the patient is able to talk and swallow. And the prosthesis is permanent because it's fixated. But at 10 days following the surgery, they have to remove this prosthesis and remove all the packing and dressing that they was placed. And this is pretty much a 10-day follow-up. At that time, what we do, the patient comes to our office and then we modify it and make a prosthesis that now is removable, and we teach the patient how to take it in and out and how to be able to talk and swallow with it and how to function with it. So this is just a recent prosthesis. We call this an interim obturator prosthesis because it still need to be modified during healing. That's another case in which you can see this is a large tumor of this patient presented. Had to have a moderate large resection of the tumor because you have a very aggressive squamous cell. 10 days follow-up, we created a prosthesis like this that was relined and it was placed in position, and the patient now was able to talk and swallow. As I mentioned before, the first function that we want to restore on this patient is talking and to swallow and to talk, because you can see there are no teeth on this prosthesis. Like here, there are no teeth. We're just obturating so the patient can talk and swallow. And of course, they have still a wound that is not completely healed. And during that healing process, then we'll help them to recover from his surgery. This case is already a healed maxillectomy. So that means the tumor was removed and it was already healed. This is pretty much the communication with the floor of the nose and the sinus cavity. You can probably even see very close to even the floor of the orbit in this case. So he has some remaining teeth. He enabled to talk and swallow, and we created a prosthesis to help them to function in this patient. Other kind of prosthesis we do are facial prosthesis. So that means this is the field of maxillofacial prosthetics. So we can create nasal prosthesis to help patients. This is another obturator prosthesis with implants. The only remaining portion of the palate was this. We can fabricate and do custom shading and coloring of the nasal prosthesis to restore the portion of the nose or the nose that was resected because of cancer or trauma or burn patients too. We use, this patient had clips or maxillofacial implants to hold the clips and hold the prosthesis in place. Most of these patients, we ask them to use glasses, and then we can create prosthesis like this. Of course, the patient walks by you, and then you might not be able to surprise that. You might actually be able to say, oh, there is something different, but I don't know what it is. But if you go close, you might be able to see the margins, okay? But it helps them with an improved quality of life to these patients. The patients can actually, in this case, because they had implants, we developed with this orthodontic wire, a little wire to pull the prosthesis from the nose or from the implant bar, so it can remove the prosthesis. Well, that was my final case, and you're showing you a little bit of what I do, or what prosthodontics and maxillofacial prosthodontics is about. What is the advice to our future dentists? Well, I wish you the best. As I mentioned before, keep working hard, keep studying all the time, but still enjoy your college life. Obtain a good GPA, obtain a good score on the DAT, and all of this achievable just with study and hard work. Perform shadowing at dental offices, perform community service. I cannot reemphasize how important is this part of community service. Be a leader position of a study club or any kind of organized group. Develop your hand skills with some kind of artistic work, because our profession in dentistry, you have to be good with your hands. That's what we do. It means I have to say that the difference with physicians is our profession is also a little hard on your body. Okay, but it means it's something that you have to make the determination that this is what you want to do. There are Nothing is perfect in life as long as you're happy and enjoy what you're doing. Okay.
Mhm.
Thank you very much for joining. And this is
Thank
my
you, Dr. Davila.
Thank you so much.
thank you very much. This is my Instagram at Tampa Prosthodontist. We always keep putting interesting cases. Thank you for your kind attention. And that's my email, my website. If you have any, contact me in the future. Thank you very much.
Thank you so much, Dr. Davila. Those were very interesting cases. Some of the teeth looked like just like the other ones. It was very cool.
Yeah.
I think we might have some questions in the live stream chat.
Yes, I'll be happy to answer.
Okay. So the first question is, what is the most rewarding part about being a prosthodontist?
Well, the most rewarding part is the gratitude of patients after we have helped them to improve their quality of life. I don't know, I see sometimes post pictures. It means we helped a patient recently. He brought plants for me, for the assistant, for the front desk staff. So they are actually very grateful for because they actually feel good about themselves. They feel better about themselves, and the gratitude is the most rewarding part of it. Being able to have the skills to help patients that that have complex problems. Yeah.
Thank you. And we have another question saying, do most implants take about 6 months to heal? Or how long is the process for implants?
I always put this analogy. For example, when you have a broken bone, okay, and you fracture your arm or your leg, and they put a cast on you and they wait several weeks for that to heal, right? So similar process is when you place an implant. Okay, studies have shown that the majority of implants, even in the 60s, okay, it takes about 10 weeks, 10 to 12 weeks to heal completely and to have the union of the bone to the dental titanium. So that means we call this osseointegration. So normally under normal conditions, I'm talking about the type of bone is also a very important part of it. There are different densities of bone. So if the bone is adequate, you have enough weight, not a compromised situation, and you place an implant, probably going to take about 3 months. But there are things that go out of the rule. There are things that we can do more challenging when there is not enough bone, when there is grafted bone, when the bone is very soft. So that means then we have to actually have our clinical decision to wait longer for that to heal.
Thank you. What are the options patients have after a failed dental implant?
Well, like in medicine, there is nothing 100%. Okay. Most of the major dental implant companies, they have the most studies and the most background. There are probably about 5 major dental implant companies. They have almost of them a success rate of about 98% when the conditions are adequate. And also, they are very good implants because they can actually be predictable on challenging cases. Okay, so that means if an implant fails, and these companies, that leads me to about 2%, right, or 1 or 2%. So that means if we place maybe 500 implants a year, or we probably do about 500-600 implants a year, it's possible that we may have 2%. We may have maybe 4 implants that don't take for X reason. Could be a medical condition, could be the bone, the density of the bone. So that means most of the time, or all the time, the companies that I work with, these 5 major companies, they will provide you a new implant at no cost. So that means, and of course, in return, we offer the patient that will replace and do another implant procedure at no cost because we already had at that time. And so that means we can actually have a warranty from the implant company that we can do a second procedure. And still it's possible that the second procedure will actually be a failed procedure, but very rarely. Most of the time now we know the bone is less dense, so we can actually go and find out a way to actually place it or wait longer for the bone to be denser. And then the second procedure will be more predictable.
That makes
And
sense. Thank you.
yeah, and that's if it's my patient, no? So, but still, the companies are behind your work, and that's why there are companies like in anything. For example, there are things that are inexpensive, that there are things that are more costly, or we would say they have the value of the things. Okay, for example, we can have implants that you can pay about $50 or $100. Okay, from companies that we don't know much about them, right? But from those reputable companies, you pay now $500 for an implant. And you say, I'm talking about just the implant, not the procedure. So that means why one could be $50 and the other one could be like $500 just in the value of the implant. But it's pretty much the quality, like in the value of different cars, brands, the value of different procedures, what it means, or different what you use. Definitely, you have actually a good shirt for that value, and then another one you buy. Why you're buying now probably a shirt that will cost you 150 is because you think that that's the value, and you think that the value of it is worth of it because it's better quality, everything. It's the same thing in dentistry. See, that's why as a specialist, we always have to look for the best companies that can support my work, because a lot of the patients are referred also by the colleagues in our community, and we have to provide them with the best products. Yeah.
Thank you. I wanted to ask, what technology do you look forward to the most? Do you feel like a certain field or procedure is in need of a new software or device?
Well, definitely intraoral scanners and CBCT. I would say that people will say, I'm an early adopter of this technology. So that means I've been using this already for 15 years. And at the beginning, the technology was very of minimum help. It will help me, but very minimally. Okay, so that means I could use it maybe once a week or maybe once every 2 weeks because it still was not there. You see? Right now, and some people, but also help me to develop the skill to find a way to actually see how this can be used. And with time, also the companies develop or improve the machine, improve the software, and some companies, they're always all the time changing and improving the intelligence of the software. So, for example, I mentioned things that we were not possible to do a few years ago, and now we're doing it because the intelligence of the software or the quality of the software is better. So there is a lot of always improvement. I would say right now that even though there's still clinicians that we use the analog technique, analog means regular impressions that are placed into the mouth, make models, and also regular 2D x-rays in which you don't have the actual real width of the bone. So you still are missing a lot of information that is needed to provide certain more complex treatments. You see? So right now I would say that I cannot practice if I don't have an intraoral imaging scanner and a 3D x-ray or a cone beam technology. So it'll be hard for me to practice the type of dentistry that I like to do.
It's really amazing how far technology has come.
Especially the 3D printing.
Yeah. 3D printing keeps improving and improving. We do a lot of that for models, for guards, for surgical guides. Now we're beginning to do for dentures. I still don't trust the dentures much yet. Maybe temporary dentures because still they are not as strong. But definitely that's the future. Talking about 3D printers, 3D printers is an additive technology. So that means we have resins or materials that keep adding to create the final restoration. What is being proven is the other technology, what's called milling. So they have the machines that I show you are milling machines. Milling machine or CAD/CAM machines, they have blocks or cubes or discs of porcelain material or PMMA or different resins, in which once you have the final restoration in the software or the 3D creation, you ask the machine to mill it, but now it's subtractive, it's grinding. Like I always put the analogy of, you have seen this movie of Scissor Hands, right? On Scissor Hands, he has a big tree and he makes nice figures and statues by cutting with his scissors and all of that, like this, right? So that's pretty much what we're doing, and it's proved. We have these milling machines, and we have a block or a cube or a disc, and now we have burrs that with 3 dimensions start carving the crowns, the resins, the frameworks, even everything. But that technology will change, because now once 3D printing becomes better materials and better resins, so then will change, and now 3D printing will be much better than milling. You see?
Mm-hmm. It's really amazing.
The future.
That's amazing.
Yeah.
Mm-hmm. All right, guys. Well, that's all the time we have today for questions. And thank you so much, Dr. Davila, for giving that amazing presentation. I definitely learned a lot about prosthodontics. So thank you very much.
You're welcome. I was very happy and very, thank you very much for your invitation. Okay, and
thank you.
We keep in touch. And I will say always go digital.
Go digital. All right. Have a nice night, Dr. Davila, and everybody else. I hope you all have a great night. And Isa will post the
I'm about to post
attendance quiz in the chat.
All right.
Thank you so much, Dr. Davila.
Take care.
Bye.
Thank you for joining us.
And I forgot to mention yesterday, but the quizzes will stay open for 12 hours now. So if you guys can't make it to any of the sessions, you can still watch the recording afterwards and submit your quiz 12 hours after the session ends. All right, guys. Have a great night.
Have a good one, everyone.